Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we will be seeing about essential newborn care. So why we have to consider the newborn care? Because since the about 40 to 42 weeks, the baby is inside the intrauterine life, that is inside the mother's womb. So once the baby comes out, it has to adapt to the extrauterine life, as well as the baby will automatically adapt to the extrauterine life by vigorous cry, taking a first breath, then all various organ changes takes place, various organs gets matured, and circulatory system gets activated and cardiovascular system gets activated. So in that cases, we also has to provide some of the essential care in order to improve the survival rate of the newborn. So newborn, when we compare with the adult, they are very much different. When we consider about physiological changes or psychological changes, the newborn is different from adult. So we have to provide a essential and that means adequate care in order to improve their adaptation from the intrauterine life to the extrauterine life. That care includes first is assessment. So we have to assess the by periodical examination we will come to know whether the baby is having any abnormalities or not, or what is about the Apgar score of the baby. Then we have to dry the baby properly. Then we have to remove all the secretions from the mouth and noses so that the baby can breathe properly. Then either any additional support is needed or not, we have to see it, and we have to administer the vitamin K administration. We have to initiate the breastfeeding as soon as the baby is born, like within 30 minutes we have to initiate the breastfeeding from the mother, because the breast milk is a nutritional package that has to be delivered to the baby as soon as possible. So we will see one by one in detail about what is meant by newborn care and what is the essential newborn care. A newborn infant or a neonate is a child under 28 days of age. It is thus crucial that appropriate feeding and care are provided during this period, both to improve the child's chances of survival and to lay the foundation for a human life. So once we provide a proper nutrition to the baby, that is proper nutrition in the sense we are going to initiate breastfeeding as soon as possible. If at all the mother is not able to breastfeed, the substitute for the breast milk is breast milk itself. So in various government hospitals also we are having the human milk bank, so we can provide by giving the human milk to the babies. Next is immediate care of newborn at the time of birth. So once the baby is being delivered, head of the baby is being delivered, we'll call out for the time of birth. Next is deliver the baby onto a warm, clean and dry towel or cloth and keep on mother's abdomen or chest, that is between the breast, in order to improve their thermoneutral environment. That is, when we provide a skin to skin contact, the baby will attain either it is one of the way of improving the breast milk production and also improving the emotional bonding between the baby and mother. Next, wipe both the eyes separately with a sterile swab. Clamp and cut the umbilical cord after 1 minute if baby is breathing normally. So we have to wait till the pulsation stop, then only we have to clamp and cut the cord. And in the same way, if any secretion is there in the baby's eye, we have to clean from inner canthus to the outer canthus, and that too a single stroke has to be provided. If we do a double or triple stroke, means there is a chance of occurring infection to the baby. So we have to be very conscious in providing the immediate care of newborn. Next is immediately we have to dry the baby with a warm, clean and dry towel or a piece of cloth, that is sterile cloth. Next is we have to assess the baby's breathing while crying, because when the baby cries only, the baby will look that is full body becomes pinkish in color. So when the baby cries, the baby will take a breath. Next is leave the baby between the mother's breast to start skin to skin contact and improve the care for at least an hour. Cover the baby's head with cap. Cover the mother and baby with the warm cloth. So why we have to cover the head of the baby? Because head is having a more surface area and there is a chance of heat being lost from the head. So we have to cover the head. Place an identity label band on the baby as well as the mother. Next, encourage the mother to initiate breastfeeding within 30 minutes. So once the baby is born, we have to clamp and cut the cord, and that means we have to wait for the pulsation till stops. Then we have to clamp and cut the cord and place the baby on the mother's breast in order to improve the skin to skin contact and make the baby to be warm and improve the emotional bonding between the mother and the baby. And this act as a one of the very important, and in the same way it improves the breast milk production in the mother. Next is, we'll see one by one in detail. Call out the time of birth. So why we have to call out the time of birth is, one is for recording the accurate time when the baby is born, and other thing is we can alert the other healthcare professionals in case any help is needed. So if a baby is arrived means all the healthcare professionals will get alerted, and if any emergency is being needed, we can join hands to them. Next is, receive the baby on a warm, clean and dry towel or cloth. So once the baby is delivered, we have to use a pre-warmed towel, because when the baby is inside the womb, it is very warm and it has to get adapted to the extrauterine life. So due to the extrauterine life, that coldness, the baby will have a shivering. So in order to prevent that, we have to make the baby to wrap in the warm towel. Next, we have to immediately dry the baby with a warm clean towel or piece of cloth. So only immediately dry the baby, because if secretions are present, we have to suction first, then we have to dry the baby. This will prevent the aspiration, as crying itself is a stimulation for a baby to breathe. So blood or meconium that is being on the baby's skin can be wiped off away, and we should not vigorously wipe off the vernix caseosa, because it helps to protect the baby's skin, and for that purpose only we should not remove those cheesy white material that is being placed on the baby's body, that is known as vernix caseosa. It should not be vigorously rubbed. Next is, in case of secretions is there in the baby's eyes, we have to wipe both the eyes with sterile swab. That is, we have to clean the eyes from inner canthus to outer canthus. That too, a single stroke has to be provided. Next is, we have to assess the baby's breathing while crying. So at the time of crying itself, the baby's breathing should be assessed. A normal newborn should cry vigorously or breathing regularly at a rate of 40 to 60 breaths per minute. So when the baby is born, the immediate care we have to provide it. So if there is a secretions, for example, if the baby is having any ophthalma neonatum or conjunctivitis and all, we have to see for the secretions and wipe it with the sterile gauze. Next is, clamp and cut the umbilical cord. The umbilical cord should be clamped after 1 minute using a sterile disposable clamp or a sterile tie, and cut using a sterile blade about 2 to 3 cm away from the skin. Leave the baby between the mother's breast to start skin to skin care. So once the cord is cut, the baby should be placed in between the breast of the mother in order to improve the skin to skin contact and care between the mother and the baby. This will help in maintaining the normal temperature of the baby, as well as promoting the yearly breastfeeding. So this also going to boost up the emotional bonding between the mother and baby. Why? Because the mother was waiting for around 38 to 42 weeks whenever the baby is born for seeing a face of the baby. So in order to provide the emotional bonding, we have to place it on the mother's breast. Next is, cover the baby's head with a cap. Cover the mother and baby with a warm cloth. So both the mother and the baby should be covered with a warm cloth, especially if a delivery room is cold. We have to receive the baby in a pre-warmed towel. Since the head is the major contributor to the surface area of the body, a newborn baby's head should be covered with a cap to prevent the heat loss. So the heat is being lost from the baby's body with the 4 methods, that is conduction, convection, radiation and evaporation. So and not only that, there is an increased surface area of the head. There only the heat is being lost. So we have to cover the head. Next is, place an identity label on the baby. So we have to place a label, that is identity label of the baby on the wrist and also in the leg, and also one identity label for the mother also. Next, encourage the mother to initiate breastfeeding. So exclusive breastfeeding should be given till 6 months of age. We when the mother was in antenatal period itself, we have to educate them regarding the importance of breastfeeding. So what are the components the breast milk is having and everything, we have to educate it. Next is essential care of newborn care. One is ensuring warmth, that is warm chain, helping to establish normal breathing. Next is initiating breastfeeding. Next is prevention of infection or clean chain. So these all about the essential care of newborn. So we will see one by one in detail. So how we have to maintain the sterility when the baby is born, and what are the care we have to provide, and what are the steps we have to just maintain in preventing the infections by adopting some of the sterile techniques, that is like simple techniques like doing the hand washing when we are handling the babies, and also we have to ensure that the breastfeeding is being given to the baby as much as possible, that is demand feeding is being given to the baby. Then also we have to ensure that the baby is having a normal breathing or not. Then we have to provide a warmth, because the baby's heat is being lost from the body, that too from the head surface of the baby. So we have to ensure the covering of baby is done, that is mummification is being done properly. Next is, we'll see one by one in detail. Ensuring warmth, that is warm chain. At delivery, ensure the delivery room is warm with no draughts of air. Dry the baby immediately and remove the wet cloth. Cover the baby with a clean dry cloth. Keep the baby in skin to skin contact with mother on chest or abdomen. Postpone bathing and sponging for at least 6 hours or next day. So in order to prevent the heat loss, we have to delay the sponging for at least 6 hours, or we have to provide it on next day. And keep the baby clothed and wrapped with the head covered. Avoid bathing, especially in a cool weather, and that too for the very small babies. Keep the baby close to the mother because it improves the emotional bonding as well as a skin to skin contact that will give a warmth to the newborn babies. Next, use kangaroo mother care for stable low birth weight babies and for rewarming stable bigger babies. So we can initiate and encourage the mother as well as the caregiver to give kangaroo mother care in order to improve the skin to skin contact and care between the caregiver and caregiver and the baby, or the mother and baby, and it is going to improve the survival rate of the baby. So many researchers studies show that the kangaroo mother care improves the skin to skin contact, thereby improving the warmth in the baby, as well as it is being used as a important in aiding the improvement and production of breast milk from the mother. So kangaroo mother care is very much important, and that too in the modern days we are providing, not only the mother is providing, even the caregivers are providing the kangaroo mother care in the homes. So we have to encourage them to give the kangaroo mother care, and while giving kangaroo mother care itself we can also feed the babies. So we have various mummifying restraints, and also we have a kangaroo mother care jackets like that we can provide with the that is we can improve the bonding between the mother and baby. And we have to educate the mother and show how to avoid hypothermia, how to recognize it, and how to rewarm a cold baby. The mother should aim to ensure that the baby's feet are very warm to touch. So she has to ensure, and she has to check again and again whether the feet of the baby is warm or not. So only we have to cover the baby or mummify the baby so that the warmth is being restored in the baby, like covering the head and covering the hands with the mittens, covering with the socks, and mummifying the baby so that the heat is not being lost from the baby's body, it is being preserved and the baby feels warmth. So like not engaging the baby in very cold weather or switching on the fans like that. Next is helping to establish normal breathing. The baby's breathing should be assessed at the time of crying if the baby is crying vigorously or breathing adequately. Chest is rising smoothly at a rate of 40 to 60 times per minute, then no intervention is needed. However, if the baby is not breathing or gasping, Then skilled care in the form of initial steps, positive pressure ventilation, etc. might be needed for the baby to provide a additional breathing support, that is additional respiratory support. So we have to ensure that the normal respiratory rate is being established or not. If at all it is not being established, we have to provide other respiratory efforts like mechanical ventilators, or what, for example, we have to provide in resuscitation or not, like that. We have to see and take immediate steps to provide a prompt treatment and improve the survival rate of the babies. Next is initiating the breastfeeding. So baby must be put on the breast within half an hour of birth or as soon as possible the mother has recovered from the exertion of labor. The colostrum feeds to be given for the first 3 days of life. Initially, feeding should be given in a very short interval, that is about 1 to 2 hours. So every 1 to 2 hours we have to feed the baby, and then every 2 to 3 hours. So we have to avoid the prelactal feed. So what is mean by prelactal feed? That means in olden days and all, they will be giving sugar water or honey water to the babies. No, so that and all should be avoided. Why? Because it contains an abundant amount of sugar content in the those sugar water or honey. So that is going to cause the irritation in the kidney as well as the GI tract. So it is going to put on the extra overload on the baby's kidney and GI tract. So in order to prevent that, we have to discourage giving prelactal feeds like sugar water or honey. So we have to give only breast milk. So even in nowadays we say the substitute for breast milk is breast milk only. Okay, we have to initiate and encourage the mother to give breast milk. So later on we have to give the self and also demand feeding. So whenever the baby cries, we have to make the baby to have a breastfeeding. Next is exclusive breastfeeding technique, and its importance should be educated to the mother. That is, exclusive breastfeeding means, according to World Health Organization, up to 6 months exclusively no even water should be given to the babies. Also we have to encourage them and provide information regarding what are the importance of giving the colostrum milk, because before and all they used to express it and they used to throw off those milk, but now we are giving, as a pediatric nurses, we are giving more education to the mother and caregiver regarding the importance of colostrum milk and what are the antibodies is being present, the lactoferrin being present in the breast milk, and various immune power boosting agents are being present in the breast milk, water content is being present, and protein, carbohydrate, everything is in a good amount that is being needed by the baby. Next is prevention of infection, that is clean chain. First is clean attendant's hand, wash with soap, clean delivery surface area, clean cord cutting instrument, that is razor or blade, clean string to tie cord, clean cloth to cover the baby, and clean cloth to cover the mother. This is the clean chain we have to follow it. These all are the 6 clean practices we have to follow when the baby is born. Then only the sterility of the environment can be maintained and we can prevent the infection among the newborn babies. So these all are the steps we have to ensure as a operation theatre nurse or the nurse in charge or a nurse manager. We have to ensure these all is being practiced in the operation theatre in order to improve the sterility and survival rate of the baby and prevention of infection. Next is after the delivery, all the caregivers should wash hands before handling the baby. Feed only breast milk. Keep the cord clean and dry. Do not apply anything. That means even you should not apply any powders, baby powders or oil, etc. Next, use a clean absorbent cloth as a diaper or napkin. Wash hands after changing the diaper, and even or whenever you are touching the baby, you have to wash hands, dry it properly, then only we have to approach the baby in order to prevent the infection. And also because even the newborn babies will have a very weak immune system. So even a small action, that is we are not following the sterile procedures, means it may cause infection to the babies. Next is daily routine care of the newborn. So we will see one by one in detail. First one is cord care. So put the baby on mother's abdomen or chest or on a warm, clean and dry surface close to the mother. So change the gloves, if not possible wash the gloved hands. put ties tightly around the cord at 2 to 5 cm from the abdomen. So cut between the ties with a sterile instrument, example blade. And remember, we have to remember that if the cord is being having any meconium means we have to wipe it properly. So we have to wait till the pulsation is being stopped, then only we have to proceed for do the cutting clamp. First we have to clamp it, then we have to cut it. So this is the procedure for cord care. You should not apply any oils or any baby powders. We have to wait till the cord is being dried and fall off. You should not pull it off anything. So it will dry it after 10 to 15 days or around 1 week when the baby is being born. It will just fall off by itself. Next is like observe for any oozing blood. If the blood oozes, place a second tie between the skin and first tie. Do not apply any substance to the stump. Leave the stump exposed and nothing should be placed on it. If a stump is soiled, wash it with clean water and dry it with a clean cloth. So if it is being stained means you have to ensure that stain is being removed with the help of the clean and sterile cloth. And also we should make the stump to get being shown to the air in order to have the quick healing of that cord, and that will get dried off and being fall off very quickly as soon as possible. So we should not make any necessary efforts to pull it off. Next is eye care. A baby's eye should be wiped separately with a sterile swab. Eye drops, if it is being indicated, or the ointment should be given within 1 hour of delivery. So this can be done after the baby has been dried or when he is being held up by his mother. After instilling the eye drops, a care should be taken so that the drug is not washed off away, and the same way the eye care should be given by cleaning from the inner canthus to the outer canthus with a single stroke in order to prevent the recurrence of the infection, that is reinfection is not being affected in the babies. So only we have to provide a single stroke from inner canthus of the eye of the baby to the outer canthus. And if it is being prescribed by the doctor means we have to administer the eye drops or eye ointment based on the physician's order. Next is we have to weigh the baby, that is weighing helps to identify the babies at a higher risk of death or survival rate. Next is, that means when the baby is below 2500 grams means we have to provide a special care to prevent the low body temperature. Next is below 2000 grams means should receive a prolonged skin to skin contact like kangaroo mother care. Next is, if the baby is less than 1500 grams, we have to refer the baby to the tertiary care hospitals in order to provide additional support like mechanical ventilators or any other additional support has to be provided for the respiratory support or cardiovascular support. Next is administration of vitamin K. So vitamin K will protect the babies from serious bleeding. Give vitamin K by intramuscular injection, that is 1 mg for every newborn and 0.5 mg for less than 1000 grams if the baby is born. Next is encourage the mother to breastfeed their baby during the injection for comfort. So if a baby is crying means we can encourage the mother to give breastfeeding so that the vitamin K administration can be done. Next is immunization. In all institutional delivery, the all neonates should be immunized with BCG vaccine, 0 dose of oral polio vaccine, hepatitis B vaccine is given. And in the same way, we have to ensure that we have to educate the mother regarding the universal immunization schedule or national immunization schedule and get the follow up. So what is the next dose? So after the birth dose, when the mother has to come for the next dosage should also be given to the mother. That is, education should be given regarding the immunization schedule. So this is going to help the baby to improve their immunity, as well as this is the compulsory dose in every maternity hospital. We used to provide the birth dose immunization. Next is monitoring the baby, that is breathing. Listen for grunting, look for chest indrawing and fast breathing. Next is warmth. Check to see if baby's feet are cold to touch by using dorsum of your hands. Next is color. Evaluate the color of the trunk and extremities. So when we have to check the the extremities. So sometimes what happens, the baby's body will be pink in color, sometimes the extremities will be bluish in color. So when the baby cries, so all the body parts becomes pink. So that only we are checking the Apgar scoring. Next is nursing care of newborn and family. So initial feeding has to be started. Next, bathing, sleeping positions we have to provide in a proper way. Next is diaper change, and diaper area should be cleaned in proper way in order to prevent the diaper rashes. Next, metabolic screening test has to be carried out, like congenitally if they are having any metabolic disturbances, that if family history is there means, or any query is being there while diagnosis means, we have to check all the metabolic screening test. Then all the auditory test is being done. That is only known as the periodic examination. From the head to toe, we used to do the examination in order to identify any abnormalities is there or not, or does the baby require any emergency surgical intervention or not. So any medical intervention has to be carried out or not. Like that, we have to see and check immediately. Once the baby is born, we have to do the immediate assessment. Then this is all the essential care in order to boost up their normal living and improve their survival rate and improve the quality of the living of the baby. So in initial feeding, the term newborn who is to be breastfed may be fed immediately after the baby is born. So when a baby is born by vaginal delivery, we can start the breastfeeding as soon as the mother is ready and baby is ready, that is within half an hour. If it is going to be the lower segment cesarean section, we have to check whether the mother and babies are ready, then only we have to initiate the breast milk. Next is sleeping position, we have to provide a supine position. Next, metabolic screening test, every infant must be screened for phenylketonuria, that is a disease of defective protein metabolism, or the cystic fibrosis. So this conditions has to be screened out for every babies in order to identify any abnormalities in the metabolic system is there or not. Next, we have to provide a diaper area clean, that is when we are providing the diaper, that too nowadays we are all the mothers are giving the diaper care, like if they are providing the diaper the night time means, we have to ensure that every 2 hours once it is being wet, we have to change the diaper. So these all about the newborn care, that is essential newborn care, which comprises of immediate care, thermal care, umbilical cord care, breastfeeding, hygiene and identification of any danger signs. So once we come to know what are the different danger signs and what are the flag signs we have to assess, only we can notify to the physician or the mother, and we can take the prompt diagnosis and treatment and improve the survival rate of the baby and improve the quality care to the babies. So since the babies are very minute creature and they are very different from the adult, they has to be cared in such a way to improve their health status, that is both physiological and psychological status. So that's all about the essential newborn care. So if you have any doubt, kindly drop down in the comment box, and you can also suggest me any topics to take during the videos. I'll prepare the PPT and we can share it in the YouTube. So if you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it, and thank you for watching.